Here we go. Recording is in progress. All right, so this is not going to necessarily apply, but welcome to the class. This just says to unmute your microphone. If you want to talk, the chat feature is disabled at this point. All right, so change a habit and you will change your life. So today we're going to talk about why learn about diabetes. And the first thing is education is the cornerstone to good blood sugar control. So it's important to get education. You, the person with diabetes, has ultimate control of your diabetes. And I'm not sure who all of you have diabetes or if any of you have pre-diabetes or you're not sure. We're going to talk a little bit about pre-diabetes, but most of this is going to be geared towards type 2 diabetes and managing that. So the goal is that the closer your blood sugar is to normal, the less chance you have of complications from diabetes. So that's the ultimate goal that we're searching for. So what is diabetes? So with diabetes, the problem is either the amount of, there's a problem with either the amount of insulin your body makes, or your body's not able to use that insulin. It's something called insulin resistance. And the little diagram here talks a little bit more about that. It's kind of an example of what that looks like. And we'll talk more about the role of insulin and the blood sugar and how it gets into the cells in a couple more screens. So what is prediabetes? Because you probably have heard that expression before. You may have heard something called insulin resistance. You may have heard borderline diabetes. Those are just all terms to kind of describe the same thing of what is prediabetes. So prediabetes is a condition where your blood sugar is higher than what they consider normal, but not high enough to be considered type 2 diabetes. So why is this important? It's important because when your blood sugar is high above those target ranges, there's already damage that can be done to the heart and the blood vessels. So it's kind of like if you think about salt, when you pour salt on a wound, it kind of smarts, it kind of hurts and it's irritating. The same thing with sugar in our blood vessels. When we have too much sugar hanging out, blood sugar, blood glucose is another here. It's the same thing.
So we logged on and this just went and it zoomed over here.
It went blank.
I'm sorry.
Tried plugging the cables back in. Nothing happened. I did power cord it as well.
Hold on a second. I need to.
Man, mama busy here.
Mary, you can try to mute everyone and then they can unmute themselves if they have a question.
One small way. It was so small. What you
Okay,
doing,
yes, everybody should mute their microphone unless, and then just one should.
All I
Okay.
wanted to do was get her up and running.
Oh, that's what you say. Show only one.
I
right
didn't
there.
do anything.
Hold on a
Yeah,
second.
you show duplicate expand. You show only one. That's why you only see one over here. You see right now? Okay. now.
Oh, that was a setting change.
Yeah, because they're changing so.
Like-
Okay, is that better?
Yes.
Okay, thank you. I'm sorry about that. Okay. All right, so so when you have there we go. So when you have excess sugar in the bloodstream, it can irritate the vessel walls, kind of like sodium does or salt. And then that can cause damage to those vessel walls and plaque buildup to kind of protect the vessel. And then you can get blockages and things like that. So, and we can talk more about that as we go along. People with prediabetes usually develop type 2 within 10 years after their diagnosis. So it's not inevitable. The good thing about the good news, I guess, if you're having prediabetes is there's a lot of things that you can do to make changes so that you can prevent or certainly delay developing type 2 diabetes. One of those things is that just losing a small amount of body weight between 5 to 7% can decrease your risk of developing type 2, as can more activity and exercise. And hopefully that will certainly delay or prevent it. Okay, so one of the types of diabetes is type 1 diabetes. It used to be called juvenile onset diabetes. That might be a term that you've heard of, but it can also be diagnosed in adults. And when you have type 1 diabetes, the pancreas makes little or no insulin at all. So the little picture that I have there is a picture of kind of what the pancreas looks like. And it's situated in near the stomach area on the person, which is kind of a good place for it because it's the pancreas is what produces insulin, and insulin is a hormone that is needed in processing the sugar in the body. So when you take your food in and you digest it, it's right there. The pancreas is right there to release that insulin. Type 1 diabetes is less common than other types. About only 5 to 10% of those with diabetes in the US have type 1. So it's not as common, but definitely is there. Type 2 diabetes, which as you see, 90 to 95% of those with diabetes in the US have type 2. So it's the most common. And the primary problem with type 2 diabetes is insulin resistance. Excuse me. So another picture here is your cell. And the sugar in the blood that is produced, that comes from digesting your food, needs to get into those cells so that you can function. And we'll talk. I'm getting ahead of myself. So there's a couple more screens back that I'll explain more about that. But people with type 2 diabetes are usually diagnosed after about age 40. But unfortunately, it's becoming more and more common in children and in teenagers. So you'll, in the school system, they're trying to do a lot of prevention and a lot of education on preventing type 2 diabetes. Because if you think about it, if you are diagnosed with type 2 as a youngster, that's a lot of years that you will be living with type 2 diabetes, and a lot of things can occur during that time. So the goal, as we talked about earlier, is keeping that blood sugar under control. And in hopes of doing that, you can prevent type 2. So in a normal blood sugar in a healthy body, the blood sugar stays within a healthy range. So you take your food in, you eat your food, it's broken down in the stomach into all the different nutrients that we need, and it travels into the bloodstream. Insulin is a hormone that is produced by the pancreas, and it's the gatekeeper to the cell, if you will. It unlocks the cell that allows the sugar to get into the cell. So you need to have the right amount of insulin released at the right amount of time. So the correct dose at the correct time for all of this to function correctly. And that's generally how things work. So you have kind of 3 diagrams to kind of show that. So it's the key or the gatekeeper to the cell. So hyperglycemia is when you have too much sugar in the blood. So it's hyper is too much, glycemia is the sugar. So this can happen when the liver releases too much sugar. So a lot of times during the night, as you are sleeping, when your blood sugar starts to fall because you're not eating, the body will sense that and it releases sugar into the bloodstream to raise that sugar. And during the nighttime, sometimes it can release too much and you end up with high sugars in the morning. Another option that occurs with hyperglycemia is that the cells are resistant to the insulin. So they don't let the insulin help usher the sugar into the cells. And the other option is too little insulin is made by the pancreas. So those are the 3 things that usually occur in high blood sugar. So question is, how is diabetes diagnosed? So you have, this is just kind of a diagram that talks about the hemoglobin A1C, the fasting plasma glucose, and the oral glucose tolerance test. And my next screen is going to describe those in a written format. So we can talk a little bit more, but I kind of like this visual because it gives you the normals, and then the yellow category is what your numbers would be if you had pre-diabetes, and then the red category is whether you have diabetes. So for instance, in the hemoglobin A1C, the hemoglobin A1C is a blood test that we do in kind of in conjunction to the fasting one usually. And about every 3 to 4 months, your body produces new red blood cells. The hemoglobin is part of that blood cell, and the sugar attaches to the hemoglobin. So when we run this test, we can tell what your sugar has been doing over that time period. So it captures the times when you don't normally test. So the normal is less than 5.7. The pre-diabetes stage is between 5.7 and 6.5. And then when you get over 6.5, generally is when you're diagnosed with diabetes. And they usually do this test about every 3 months. And if you're pretty stable, they might stretch it out to 6 months, just depending. You do not need to be fasting for that one because it's an average over that time period. The fasting plasma glucose is a fasting test. So you don't usually drink after midnight or 8 to 10 to 12 hours. You can have water, but nothing with calories. And you go in, you have a blood test done. Normal is less than or equal to less than 100. Pre-diabetes stage is between 100 and 126. And when you get over 126, that's a diagnosis of diabetes. And they usually 2 tests. They don't just determine that on one test. Sometimes they do that in conjunction with the A1C for a diagnosis. And then the oral glucose tolerance test is a little bit more like, we use that for women who have gestational diabetes when they're pregnant. But this one is you drink a certain liquid, a certain amount of glucose in it, and they time the test as to when they do it. And they're usually seeing how does your body process your food or the sugar after you have taken it in. And so they usually test about 2 hours after, and so it should be less than 140. The greater than or equal to 140 to 200 is pre-diabetes, and then over 200 is considered diabetes. So this just gives the written version kind of basically what I said, just to have that piece too. And then for the oral glucose, they take it 2 hours after you drink a certain sweet drink. It's very sweet. Again, I said they usually use that with women who have gestational diabetes. So what are some of the risk factors that we have with diabetes? Family history is a big one. If you're 20 pounds or more overweight, not too active, high blood pressure, high cholesterol, stress. We sometimes undermine stress a lot, but it really plays a role in our health, both mental and physical. Injury to pancreas, like if you've had a motor vehicle accident, something like that, age. And so all of those are risk factors. It's not inevitable that you're going to get diabetes because you have these risk factors. It just increases your risk. So some signs of hyperglycemia, which is the high blood sugar, might be that you have a lack of energy. Maybe you're thirsty more than usual, or you're going to the bathroom, blurry vision, slow healing, cuts or wounds, hunger, frequent infections. So all of these can kind of be associated with many things, right? Who doesn't feel like they're tired, a lot, or they have too many things on their plate. But these are generally occur kind of on a regular basis, and they're not generally related to other things. So if you're thirsty, then you're wanting to drink more, which is going to make you go potty more. A lot of times people will think, man, I just am having a hard time seeing my screens. I'm having a hard time driving. They think they need, their vision has changed, and they go, to the eye doctor, and, they get tested, and it's not really their vision. It's because of the high blood sugar. Or some people will come in and they'll be like, I have this wound. I got cut on my leg, and it just won't heal. I've tried everything, and they run their blood sugar and they find out that it's elevated. the hunger one is kind of interesting because we think that, you know, if your sugar's already high, then why are you hungry? Well, it's because the sugar's not able to get into the cells. So the body doesn't recognize that you have that sugar. It's saying, my cells are hungry, I need more food. And so another one that's not on there that occurs is unexplained weight loss, or you lose a lot of weight. And again, that's because the cells aren't getting the sugar that they need. All right, questions, anybody so far? I know I'm kind of rattling through this, but feel free to unmute and ask a question if you need to. All right, so the reverse of the hypoglycemia is, or the hyperglycemia is the hypoglycemia, and that's the low blood sugar. And sometimes these symptoms can be the same, like you may get a headache if your sugar's high, you may get a headache if the sugar's low. But other symptoms that occur is you might feel dizzy, you're a little shaky, like you'll see your hands starting to shake, lightheaded. Hunger could be another one for both, high or low, sweaty, irritable. The heart's beating faster, you just start to feel really anxious and ramped up. Those are some symptoms of low blood sugar. So if that were to occur, what would you do to treat it? And if you have type 2 diabetes and you're already testing your blood sugar and your sugars, you know, you get some of those symptoms, and go ahead and test again. And generally this occurs if the blood sugar is 70 or less. But sometimes if your sugar has been really high, let's say it's been in like the 200s or something, and your sugar starts to drop, you may have these symptoms when it's like, you know, 100 or 80. And if that's the case, you would go ahead and treat it as if it's low sugar. And then over time, as you continue to get those sugars closer to the target ranges, then it should be more occurring when you're around 70 or less. So what you would do is you test, then you would drink you could drink a half cup of juice, you can drink maybe half a can of regular soda, not the whole can, 2 to 3 to 4 glucose tablets. You could do about 7 or 8 Lifesaver candies. But you'd have to chew them, crunch them, or get the gummies. And then you're going to wait for 15 minutes. And that's really hard to do, because if you do have a true hypoglycemic reaction, you're really hungry and you want to eat everything in sight because you want to feel better. You want to get that sugar up. But in this case, you want to wait for those 15 minutes, and then you're going to retest your blood sugar. If it's still low, then you repeat that cycle. If you've done that twice, and you're still having low sugar, you're still having symptoms not improving, then get to the emergency room and get some help, because it may continue to drop, and you don't want to drive yourself because you don't want to have a problem out on the road. Ways to kind of prevent this from happening is make sure you're eating something about every 4 to 6 hours. And then that way, that can kind of help you to maintain your blood sugar so you're not having a bunch of highs and lows. Certainly, if you do have a situation like this, then you want to go ahead and eat some, you know, food like some protein, some vegetables, things like that. Maybe a piece of fruit, something that has carbohydrates and protein in them. Okay. So one of the things with diabetes and type 2, type 1, any of the diabetes, is that you're trying to prevent long-term complications. And so the way to do that is try to keep those blood sugars as close to normal as possible. So these are the suggested ranges for your blood sugar. Fasting or before meals, 80 to 130. 2 hours after meals, less than 180, and at bedtime, around 100 to 140. I have a picture of the feet because feet problems can be a long-term complication. So, so for those of you who are doing blood sugar monitoring, or maybe you're wondering, should I be testing my blood sugar? Things like that. It's certainly a conversation you would want to have with your doctor, because they would need to order this. you know, for your insurance coverage and things like that. But checking your blood sugars pretty regularly is important in managing your sugars. And the thing that we like about testing your sugar versus just doing an A1C is that you can capture the times when the sugar is going up or down and be proactive in trying to get it back within the target range is a little quicker than if you were waiting every 3 months for an A1C. So the combination of both of those tests, a hemoglobin A1C and self-monitoring, is a good combination to maintaining or to managing your blood sugar. The other thing when you take your blood sugars, you want to make sure you're logging it. And you can, you know, as the picture shows, you can do a paper log like this, but now they're so tech savvy. You can do a Excel spreadsheet if you want. You can leave them in your do the memory on your machine. But whatever you do, you want to take in 2 to 3 weeks of blood sugars before you go in to see your doctor every time. And even if they don't ask you to see your blood sugars, just say, hey, I brought my blood sugars in. Would you please take a look at them? And that way you have some good current data for them to look at. And a lot of times that's how they adjust your medication. So it's a good thing. All right, so medications, I could probably do a whole class on medications, so we're not going to go there with that. But just know that there's many different kinds. There's pills, lots of different pills. And they work in all different ways. There's injectables, insulin and non-insulin injectables. And so there's just different ways to manage your sugar in the medication realm. So the main thing is you want to have a really good relationship with your doctor so you can talk about what your options are and what's going to work best for you. And also it's not a one size fits all. Medicine's not an exact science. So there is a little bit of trial and error, and what might work for your great Aunt Susie is not necessarily going to work for you. So just kind of keep that in mind too. All right, so let's talk a little bit about the food. So the biggest thing with one of the biggest things with managing your sugar, we know, is watching how many carbohydrates you eat. So carbohydrates is one of the first things that breaks down in our body for energy. And we know that it raises our sugar the quickest, followed by protein, followed by fat. So we don't want you to avoid carbohydrates completely. We're not about eliminating food groups because we need the healthy nutrients that all of our food groups offer, but moderation is going to be key. So some of the foods that have carbohydrate, you see the one picture there is like your breads, your grains, rice, pastas. Your starchy vegetables are, you know, your potatoes, corn, peas, beans, fruit and fruit juice. Those go together. Milk, including yogurt, and your sweets. So all of your cakes and cookies and things like that. Cheese is not considered a carbohydrate, even though I've got dairy there with the milk and yogurt. It's considered a protein and a fat. So, all right. So you want to have carbohydrates in each of your meals, but it's important to measure the size. And so if I can, I'm going to do, let's see, I was going to do I've got a couple visuals here as far as sizes, but I didn't bring all of my food models because that would be kind of hard to do. But you want to make sure that when you're planning your meals that that you have a good variety. Our bodies become very efficient at processing the food. So a lot of times people will say, well, I just eat the same thing at breakfast and lunch, and they tend to eat the same things. Well, over time, then you're not going to really get all the good nutrients that you need if you continue to eat the same thing all the time. And your body will get pretty efficient at processing that. So we like variety. It keeps the metabolism up. It keeps it moving. And we don't get bored too, because if we tend to get bored with things, then we kind of fall off the wagon. So this says about eating non-starchy vegetables and lunch and dinner. So you don't want to just eat carbohydrates. You want to have some protein. And I brought my an example of a plate here. So let me see if I can stop my sharing here and see if I can see here. Oh goodness, I'm not too good at this. Alrighty, let me see if I can. Oh, just shown. Okay. I was thinking I would see my face, so sorry. All right, so I brought my plate, and this has a this is just an example of the 9-inch salad plate that we recommend. Usually it's the salad plate. So and I'm going to show you in a couple screens about what this looks like again, but generally half of the plate you want your non-starchy vegetables, a quarter of your protein, and a quarter for your grains. So when I talk about the good plate method, this will come into participate or come in handy with that too. Okay, also the other thing is it's important to not skip meals, and you want to make sure that you are eating, you know, you don't have to be like so specific that you only eat at 8 in the morning, 12 at noon, and 5 at night. Not that specific, but you want to make sure you're eating breakfast, lunch, and dinner. And a lot of times people say, oh, I never eat breakfast. I haven't done it my whole life. And all I can say to that is maybe give it a try. And that it doesn't have to be, you know, this full course breakfast of pancakes, eggs, and sausage and so on. Just, you know, maybe a hard boiled egg and a piece of fruit, something like that. So it doesn't have to get too complicated, but it does exactly what it says. It breaks the fast, and it helps get your metabolism and your digestion going. Okay, well, here we go. Here's my plate planner. So this is one of the things that we use when we talk about planning your meals and making sure you're getting the proper nutrients. And I showed you my plate. So if you use half the plate is your non-starchy. So your non-starchy vegetables are going to be your salads, your broccoli, cauliflower, carrots, cucumbers, tomatoes, zucchini, all of those types of vegetables. They have a lot of water content in them, and they don't generally raise your blood sugar too much. So you don't really have to count those. You just want to eat quite a few of them. They also have fiber. And then a quarter of your plate would be your carbohydrates, which again were those bread, cereals, rice, your pastas, milk, things like that. And then your meat. So it could be meat, it can be chicken, fish, it could be tofu, soy products, eggs, you know, cheese, some of those other non-meat options. And then you see there's you can have your fruit. If you look further into your map, the fruit, you can have your milk. And then free foods would be like if you wanted to have pickles or you know, some of your non-starchy, but like, you know, celery and some carrot sticks or something like that. You can have those. Condiments are considered free foods, unsweet tea, things like that. Okay, so this is this plate method, and you can get this off of I've got sources at the end of the presentation, and you can get copies of these. It's put out by the government. And what's good about this is you can just use this as a guideline wherever you're eating, whether it's at a restaurant, if you go to a potluck at work, if you're at home, if you have, you know, at a church meeting and people are bringing food in, you're at a reunion, wherever you go, this is just your good basic meal. And if you look at the carbohydrates, you have your peaches up there in the corner, you have your potato, you have your milk. That's approximately 45 grams of carbs. And we're not getting into carb counting in this presentation, but Just to give you an idea, this is like a standard meal for most women and men as well. Men, you can even add another, like a roll, and you can have a little bit extra. Men get to have a little bit more because they have more muscle mass, so they burn their stuff, their calories more effectively. So anyway, that's just a good thing to consider for your planning purposes. All right, so the other thing that's really important in managing diabetes is exercise. So you can call it activity, however you want to say it, but movement is hugely important. And part of the reason why this is so important is because when you exercise, if you remember from earlier in the presentation, I talked about how insulin is the gatekeeper to the cell. It opens up the cell, allowing the sugar to come in. When you exercise kind of pushes that sugar into those cells without requiring as much insulin. So it is huge in managing blood sugars and in managing diabetes. It's something important. So unless you get discouraged and think, okay, I got to go to get a gym membership and I need to do this every waking moment. That's not how it works. The first thing we usually talk about is just to try to get moving. So do a little bit more today than you did yesterday, and so on and so forth. So before you do anything major with exercise, though, you definitely want to have a discussion with your doctor. So talk to your doctor first about what's appropriate for you, because I don't know all your health history, but your doctor will and can kind of tailor make it for you. And there's all kinds of things for some people who have joint problems. You can do exercise bands. They're stretchy bands, and you can do upper body. Anything that moves the upper body is going to get the heart going. And if you have, I had a lady one time that she had double knee replacements and she couldn't really walk, but she wanted to, and she couldn't kneel, but she wanted to weed her flower bed around her patio. So she sat in a chair and she bent over and weeded, and then moved the chair, to the next spot, and so on, and moved her chair all around her patio and weeded her flower bed. So there's lots of different ways to get moving. You do want to start slow and then just build your way up. And you want to make sure it's something you like to do, because what happens when we don't like to do something, we're not going to do it, right? So if I were to say to you, you need to, do 15 jumping jacks, you need to swim a couple miles, you need to get on your bike, and you don't like any of those activities, then the likelihood of you accomplishing that is going to be pretty nil. So make sure it's something you like to do. I always say the hardest part to exercise is putting on your shoes, basically getting started. Some other things that you can do that are pretty, fairly easy is park your car way out in the furthest part of your parking spot at work or at the mall or the store, wherever you're going, and walk in, take the stairs instead of the elevator. When you're at home and you're wanting to, like watch a movie instead of sitting on the couch for 2 hours, maybe get up halfway through and go get a glass of water. Not a boatload of food, just, water or a non-calorie beverage or something. I had another coworker who used to walk around the house talking on the phone. So that's another way. You can play with your children or grandchildren, take them to the park, offer to, there's, my daughter has a Wii, and it's, they do like dance videos or whatever. So I do some dancing with her. It's nothing anybody else wants to see, but she thinks it's quite funny. So anyway, there's ways to get exercise in and doing things that you like. So some of the benefits are, there's lots of great benefits, but some of the main ones are you have a reduced risk of heart disease. And so basically when you do that cardiovascular, it's called aerobic exercise, when you get that heart beating, it helps build what we call collateral circulation. So it builds new vessels and pathways in the heart, so that if you do have a blockage, the blood can go down a different pathway and decrease the damage that could occur. So it's huge in reducing heart disease. Plus, I kind of look at it as like it cleanses your vessels. It's pushing the plaque and things that you don't want in there. It helps keep them clear and prevent heart disease that way. It can also help you lose or maintain weight. It may reduce your need for medications. So it can decrease your need, especially for the diabetes meds, because one, if you're losing weight, that could be a factor. Plus, if you're exercising and it's pushing that sugar into those cells, you might not need as much medication. It gives you more energy. And people who regularly exercise are about 250% less likely to die of a heart attack. So that's a pretty good incentive. It reduces your stress. It gives you more restorative sleep, a better quality of sleep. And it helps you to manage your blood sugar levels. So it does a lot of good things. All right, so the other thing that's important to think about with exercise is that something is better than nothing. So you can break up, so the government puts out standards, exercise guidelines about every 10 years. And the recommendation is 150 minutes a week. So that's roughly 30 minutes, for 5 days of the week. So a lot of times people say, well, I just don't have 30 minutes, or I don't have this or that. You can break it up into 10-minute increments. So maybe go for a walk after lunch around your around wherever you work. And even if you can't do outside, maybe go up and down the stairs a couple times. Anytime you have the opportunity to move or to walk or anything like that, try to take it. And the suggestion here is a 10-minute walk after your meals is a great way to get started. So when you walk after your meals, that exercise helps use up all that food you just ate, and it decreases your need for insulin. So it's a good thing. All right, so preventing complications. So when we think about some of the complications that occur with diabetes, like it can affect your kidneys, your heart, your blood vessels, the nerves in your body, can affect your eyes, lots of different places in the body when your sugars are high can damage those organs or vessels. So again, the best way to decrease that and to avoid those is to keep your blood sugars within those target ranges. The other thing that's important is to make sure you're getting checkups in certain areas. So for instance, I mentioned about every 3 months getting your A1C tested. You also want to get your blood pressure checked and dental checkup. They've done a lot of studies about the correlation between dental care and heart disease, for instance. So making sure you get those dental checkups. A lot of times most insurances will only cover it every 6 months, but you can check with your dentist about that. But getting those is important. And then every year you want to get your cholesterol checked, have a dilated eye exam. You want to check your urine. There's a test that they can do for checking your kidney function, your feet examined, and your flu shots, or your vaccines, basically. So the pneumonia, the shingles, and those types of things. So with your feet examined, you should be looking at your feet daily. You want to look, kind of spread the toes apart, look for any cracks or reddened areas, any blisters, anything like that. You want to check those out and make sure that they are healing. And so definitely can go to a podiatrist, or your family doctor can check those out every year. Make sure your shoes are fitting properly. We don't usually recommend flip-flops. We want to make sure that your feet are covered, and a pebble in your shoe can cause problems and you not know it. And then for the dilated eye exam, just a story about that is my mom went in years ago to get her eye exam. And when you think about getting your eyes dilated and that's one part of the body where they can see your blood vessels. And you can't see those blood vessels at any other places, but they can tell if your blood pressure's up. They can tell if you have plaque buildup. And that's exactly what happened. They found some plaque buildup on the vessels, and my mom had some blockages in her carotid arteries. So she was able to get that addressed, all from having a regular eye exam. So it's a really good thing. Sometimes we might underestimate the importance of these wellness visits, but for those of you who have diabetes or even pre-diabetes, these are important exams to have. All right, so then you wonder, okay, well, where do we go from here? So we've talked about, you know, managing carbohydrates and how to eat, you know, on a healthy plate, making good food choices. We've talked about the importance of exercise. We've talked about what is diabetes, different medications for it, lots of information. And it can be overwhelming when you're trying to manage diabetes. So we have other options for you for further education. One is if you have diabetes, we have a diabetes basic class, and they're offered online like this or in person. So it's basically 10 hours of classroom time. There's an individual session and then 3 group classes. And so you do need a physician referral for that one as well, but we go more into depth about carb counting and more, you know, sick day care and foot care and all the different things like that. A lot of good information there. You can do an individual consultation one-on-one, talk about, you know, if you're starting new on insulin or a new injectable, we can help you walk through that and show you how to use those things. And then if you're pregnant and you have gestational diabetes, we can help you manage that. We also have support groups, and these are free, and they do some really fun things in our support groups. They've done cooking demonstrations, they've done grocery store tours, they've had special speakers come in. A couple years ago, I did something on the use of essential oils with diabetes management. So your friends can come, family, support people. So that's another good option to learn about, just to have support with managing this disease process. And some of the resources, there's a huge amount of online resources out there. You always want to make sure you're on a reputable website, because you'll find all kinds of information out there that may not be accurate. Diabetes.org is the American Diabetes Association. I was just on their site recently, lots of good information there. And I know they have put out like cookbooks, they've put out books and different things. Mayo Clinic is good, CDC, there's lots for CDC. Eatright.org is the National Dietitian Association, I believe. And so if you're looking more for the food piece of it, they have stuff there. I think they even have recipes. National Institute of Health and the Joslin are more, if you're interested in kind of the research arm of things, or you know, any of that type of things, or more detailed information would be good websites. So a lot of good government resources out there that are free. So just something to keep in mind is you have diabetes, it doesn't have you. So lots you can do. It doesn't define you. It's just something you are managing, and you can do that. So if you want to learn more, there is we have the diabetes classes. This would be the number to call, or you can visit the website. And the other one is if you have pre-diabetes or you're really not sure, we also have a program for those who have pre-diabetes, and it's a free program. And you can, you know, call that number or look up that website and get some information that way. I can keep that up there, I guess, or either one of those. All right, does anybody have any questions? That was kind of a lot of information. Does anybody have any questions or anything that they want to ask about?
Sure, I do. My name's Anne, and I have, according to my bioscreening, pre-diabetes, and I've tried to stay away from the artificial sweeteners. I noticed you didn't even mention those. So if I just eat, you know, in moderation, using that plate, fruits and vegetables, you know, moderate the sweets.
Right.
I shouldn't have to worry about that, right? My concern is I donate platelets, and the artificial sweeteners lower the platelet count. So I don't want to switch. I don't add sugar to stuff anyways. but I don't want to switch to artificial sweeteners if that's
Sure.
going to cause problems.
Sure, that's a good question. I didn't mention it because we do, because there's just so much I could talk about, but we do talk about artificial sweeteners when we do a more detailed class, the 10-hour class I'd mentioned. But there are natural sweeteners like stevia, erythritol, the monk fruit. There are definitely natural ones, and I'm not sure if they would necessarily lower your I'm sorry, your platelet count. But no, you are right. We don't necessarily advocate that you go from drinking like sugared pop, for instance, to diet pop, because one, not everybody, there's side effects. Not everybody can tolerate artificial sweeteners. So for instance, if you eat too much, like let's say Russell Stover's, pecan dainties or whatever, they might have sugar alcohols in them. If you eat too much of those, you're going to be in the bathroom. Okay, so there are certain side effects. Aspartame gives some people headaches. So there's aspartame, which is the equal. There's saccharin, which is the pink packet, if you will, and then there's sucralose, which is Splenda. So those are considered artificial or non-nutritive sweeteners, and they do give a sweetened taste. They just don't add the carbohydrates. So, certainly if you are someone who drinks, a 6-pack of Mountain Dew or something like that, I would certainly want to try to get you off of the Mountain Dew. And, sometimes you can mix half and half diet, half Mountain Dew. But in your particular situation with dealing with the platelets, and that is specific, I wouldn't recommend going to artificial sweeteners, but you could ask them whether natural sweeteners would be okay for you.
Thank you.
Sure. Other questions? A lot of information, I know. All righty, well, we're almost with our hour. If there are not any more questions, then I'm going to thank you all for attending. And I hope that this was helpful for you, and you can check out some of those websites and see and get additional information that way, as well as certainly the Good Plate, the MyPlate method too. All right. Thank you, everybody, for attending.
Thank you.
You're welcome.